Well, as you can see, the N.E.D heads, they're not a usual fan group. N.E.D is a very unusual rock band, I think, so we're going to talk more about them and what their music with a message really means. Welcome back to the Dawn Show, here with Robin Cohen, CEO of the Sandy Rollman Foundation, and Adriana Weighs on the phone, Sandy Rollman's sister and a co-founder as well. So what is, when N.E.D, talk to me about what that stands for and the significance of it.
So N.E.D stands for no evidence of disease, which are the words that every cancer patient wants to hear.
So it's what they write on your chart.
N.E.D is what every doctor wants to write it on the chart. And actually when patients are in remission, they sometimes say they're dancing with N.E.D, like as N.E.D as a person.
Okay.
So the band is made up of 6 GYN oncologists. It actually started when they played for a group of their peers at an annual conference. And the name really became its mission, to raise awareness about GYN cancers, cancers that really people do not talk about, to give those cancers a voice. And it also is a way of healing, because these patients and their families became the fans, and it's a way for
the N.E.D heads,
for them to heal, and as well as the doctors to heal. And it's also, the message is that it's not just, women's cancers aren't just women's cancers. They don't just affect half of our population. They affect families, they affect careers, they affect finances. So everyone is affected by these cancers, and people should be talking about them and raising awareness. And so we really thought it was important to bring a screening to our community to get people talking.
Okay, and so tell me a little bit about the screening.
Sure, so it's going to be January 22nd. It's at the Landmark Ritz Theater in Philadelphia. Tickets are $13, and they can be ordered on our website, and we're going to have a question and answer period after the screening.
And so we're looking at, I mean, all of these people in the band, the doctor with the amazing muscular arms.
She's from Alaska, actually. So the funny thing is, I mean, the amazing thing is these doctors are from all over. They don't live near each other, and so they practice kind of on their own and over the internet, and then they get together for hours at a time and practice. But they only get together a couple times a year.
So they're making a movie as well, and they're trying to really get this word out.
Yeah.
You know, I want to ask you, as an oncology nurse, and you're such a giver. You know, when you're not working at Lankenau Hospital and working with patients, you're working at the Sandy Rollman Foundation. So for you, is the music and the fact that these are doctors, you need an outlet too, right?
Exactly. I found it fascinating, and I find it the doctor-patient relationship, you know, interesting. So to me, like, I think it's amazing. I think it's incredible. We should start a nurse band.
Can you sing? Can you rock?
No, but I could figure something out. I could play an instrument.
Is that you laughing, Adriana?
That is me laughing.
She cannot sing.
I can a little. No, I really can't. But I think music, I think really helps patients as well, and just I think makes them feel better. And I just think this is amazing how like the connection between the doctor and the patient, and it's almost like they're joining forces, you know. So to get through this horrible disease, brings like hope out there.
Is it healing for you, Adriana, when you see the doctors and their patients who are survivors? Is that therapeutic for you to see that?
Yes, I love to see that. I love when I, you know, hear that, you know, doctors found another, I don't know, something, you know, that would help a patient, medicine or something. And I love that, you know, there's so much more survival rate today than there was 14 years ago.
Do you ever think to yourself, I know Sandy's looking down from heaven and smiling?
Every day. I think that every day. Mm-hmm.
And for you?
Every day, yeah. I mean, today, her name is very much alive, and it's through the work that we do. Mm-hmm. And, you know, we know that if she were here, she would be right by our side doing that, because she was a giver, and she liked to help other people. But yeah, every day, probably not a day goes by that we don't think of her.
You know, a woman in her early 30s like that, you know, is there evidence that this is a cancer that strikes younger women in their 20s and 30s more so than other female cancers?
No, I mean, the risk actually increases with age, but it can occur at any age. And I do feel like we are seeing some younger women
I feel
develop
like that
ovarian
too,
cancer.
so-
Yeah. I mean, but 14 years ago, that was young, for a young woman to develop ovarian cancer, that was pretty rare.
Adriana, does it make you feel angry that we still don't have a screening test? Do you ever deal with anger over this?
Yes. Of course. I wish there was a screening test. I mean, I think that would be fantastic. I mean, I think that's most important. That's what we need. There's nothing out there, so all these women are just going from doctor to doctor if they don't know the symptoms and their, how their bodies are.
Right. I mean, we're not doing any better kind of educating women really now because the statistics for ovarian cancer have not changed in 40 years. So we do need more research. I mean, that's really what's most important. I think if you would ask any woman diagnosed with ovarian cancer what her one wish is, it's to live.
Right.
And so we need better treatment options and we need a test.
And on that note, we're going to take a quick break and talk more about what you can do to get involved when we come right back.